Hi, my name is Tony. I'm a nurse practitioner student at St. Thomas University, and today I'm going to be performing a head-to-toe assessment. So the first thing I'm going to do is wash my hands and introduce myself to the patient. Hello.
Hi.
My name is Tony. I'm a nurse practitioner student, and I'm going to be performing a head-to-toe assessment on you, with your permission, of course.
Yes.
And do you give consent to be video recorded for training purposes at St. Thomas University?
Yes.
Excellent. Can you tell me your first and last name, please?
Jesse Martin.
Very good. And your date of birth?
July 7th, 1992.
Excellent. Can you tell me what year it is, Mr. Martin?
2023.
And what city are you located in?
Hollywood, Florida.
Very good. So the patient is alert and oriented times 3. Visualizing him, I can see he's well groomed, appropriately dressed. He's got a euthymic mood that is congruent with his affect, and he doesn't appear to be in any distress. Prior to this exam, we did collect his vital signs and his height and weight. He has normal vital signs, a normal BMI. The patient does not admit to any mobility issues or impairments. However, the patient does have some sensory issues. He does wear glasses and he is wearing hearing aids. Okay, so Mr. Martin, I'm going to first begin by inspecting your head and scalp, cranium. I'm looking for any lesions. I'm noting the skin color, which is nice and pink. I'm feeling for any masses, lumps, abnormalities, which I felt none. And his hair is evenly distributed. The head is normal cephalic. Okay. And Mr. Martin, can you please wrinkle your forehead for me? Very good. And can you try to close your eyes against my resistance? Very good. Can you please puff your cheeks out for me? Okay. Very good. And can you clench your teeth? Very good. Okay. And so I can tell that the patient's face is symmetrical with no abnormalities or deformities noted. Mr. Martin, can you please remove your glasses? Thank you. I'm going to palpate the temporal artery. I feel normal pulsation, no lumps or abnormalities. And now I'm going to palpate the TMJ. Any pain or tenderness when I palpate?
No.
Okay. Can you open and close your mouth? Thank you. And any pain or tenderness?
No.
Can you move your jaw side to side? No pain or tenderness?
No.
Very good. Okay. Wonderful. Okay. And can you please try to open your jaw. As I press down, try to keep your jaw closed against my resistance. Very good. Very good. And now I'm going to palpate his frontal and maxillary sinuses. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Very good. So his sinuses are within normal limits. Okay. Prior to this exam, the patient did perform a Snellen test, and it was found to have 20/20 vision in both eyes. Now I'm going to assess the structures of the eye, and just visualizing his conjunctiva. It's nice pink and moist. His sclera is nice shiny white. In the cornea, I see no cloudiness, and his irises are within normal limits. Okay, so now we're going to perform a test for peripheral vision, the field confrontation test. And so, Mr. Martin, you can put your glasses on.
Oh.
Sorry. Okay, so I'm going to, can you please cover your left eye with one hand? Okay, and can you tell me what number I am holding up?
2.
Good, and again?
2.
Again?
2.
Last time.
1.
Very good. Okay, and can you cover your other eye? Okay. And can you tell me what number I'm holding up?
1.
Okay. And
1.
very good.
1. 2.
Very good. So the patient's peripheral vision is intact. And now we're going to assess the extraocular muscles of the eye. So Mr. Martin, can you please follow my pen light for me? Very good. The 6 cardinal fields of gaze are normal. And we're going to dim the lights, and I'm going to perform the coronal light reflex. And I see that the light reflects bilaterally at the same point. So that is a normal finding. And now, again, if you can please remove your glasses for me. Thank you. I'm going to, again, the lights are dimmed. I'm going to inspect the eyes, making sure that the lights are equal, that the eyes are equal, round, and reactive to light, which they are. Okay, and I'm going to test for accommodation. So, Mr. Martin, can you please look at the wall?
Okay.
And then look at my pen light and follow it, please, with your eyes. Very good. So the pupils are equal, round, reactive to light, and they do accommodate. Okay, next we're going to assess the patient's ears. Okay, Mr. Martin, can you please remove your hearing aids for me? You can do one at a time. You can begin with the left side.
Left side.
Okay. And I'm just noting any lesions, which I do not see. The eyes, the ears appear to be symmetrical with the head. And I'm looking at the auditory meatus. The canal is patent. There's no drainage or exudate. And you can put your hearing aid back in. Thank you. If you can remove this one for me. Thank you. And the same over here. The ear is symmetrical. It's free of lesions, drainage, and exudate. I'll press on the tragus. And press on the tragus here. No pain or tenderness on either side?
No.
Okay, very good. And now I'm going to perform the whisper test. Tell me what number I'm saying.
Okay. 99. 76.
Very good. So whisper test is complete and normal. And now I'm going to inspect the patient's nose. And I'm looking, well, first I see that the nose is midline to the face. It's symmetrical. And can you tilt your face up just slightly? Thank you. Thank you so much. Okay. So I see pink and moist turbinates. I'm able to visualize that the septum is midline and is not deviated, which is normal. And I'm going to check real quick for patency. So Mr. Martin, can you please cover one nostril? And can you breathe? Breathe in. Very good. Okay, any difficulty breathing in?
No.
Okay, can you occlude the other nostril? Breathe in. Okay, very good. So the nostrils are patent bilaterally. Okay, Mr. Martin, you can put your glasses back on. And now I'm going to inspect the mouth and the throat. All right, can you open your mouth for me? Okay, so the buccal mucosa is nice and pink. I'm not seeing any tooth decay. There are no lesions underneath the tongue or on the gums. Can you stick out your tongue for me? The tongue is nice and smooth. The uvula is midline, and the soft and hard palate, as well as the floor of the mouth, are intact and within normal limits. The patient does not have tonsils, and he's not wearing dentures. His gag reflex is normal. And can you stick out your tongue one more time for me? Thank you. So the tongue is midline, free of tremors, and no breath odor noted. Now we're going to move on to the assessment of the neck. And the first thing I'm going to do is just assess for any deformities, abnormalities, or pulsations. I don't see any lumps. Now I'm going to palpate his lymph nodes. And as I go, I'm just feeling for any enlargements, which I do not feel. Lymph nodes are the same size on each side. And now I'm going to assess the carotid pulse. First, palpation. Okay. All right, so the carotid pulse is nice and bounding. And now I'm going to auscultate for bruits on each side of the carotid artery. Using the bell of my stethoscope. Okay, I want you to take a breath and hold it. Okay, you can breathe. Take a breath and hold it. Okay, thank you. So no bruits noted on either one of the carotid pulses. And I'm going to inspect the trachea. I can see and feel that it is midline. Okay, and now I'm going to assess the range of motion of the neck. So Mr. Martin, can you please flex your head forward and back? Good. Can you put your ear to your shoulder on, yes, each side? Very good. And can you look over your left shoulder? And can you look over your right shoulder? Very good. And just move your chin side to side. Very good. Excellent. Okay, now I'm going to test the muscle strength of the neck muscles. So against resistance, can you please push your head back? Good. And can you press your head forward? Very good. Press to the side. Against resistance. Good. And the other side? Good. Okay, can you shrug your shoulders for me? Very good. And let's test against resistance. Very good. Excellent. Okay, now I'm going to palpate the thyroid gland. If you don't mind, can you face that way? Okay. All right. So I've located where it should be. And can you can you swallow like you're taking a drink of water? Very good. Okay. So the thyroid gland was felt, it was palpated, and I did not feel any lumps or it did not appear to feel enlarged at all. So the thyroid gland is intact and normal. And now we're going to move on to the thorax and lungs. I'm going to begin with the posterior chest wall. If you don't mind, Mr. Martin, can you face that direction? Thank you. The first thing I'm going to do is just assess the skin, making sure that it is free of lesions, that it is symmetrical, and I see that the thoracic cage is symmetrical to the patient's shoulders. And I'm going to palpate real quick, make sure there isn't any lumps, any pain or tenderness.
No.
Okay, very good. All right. And I'm going to palpate for tactile fremitus. Can you please say the number 99?
99.
Again?
99. 99. 99.
Very good. So the vibration that was felt was even on both sides of the chest. And now I'm going to percuss the costovertebral angle for any pain or tenderness. Please let me know if you have any pain or tenderness. Any pain?
No.
Okay. And then on the other side?
No.
Any pain or tenderness? Okay, very good. So it's free. The costovertebral angle is free of pain and tenderness. And now I'm going to auscultate the lung sounds in the posterior chest. Okay. Take a deep breath for me. Good. Again. In and out. Good. And the lateral sides. Okay. His posterior lung sounds are clear to auscultation. No adventitious lung sounds were noted. And you can face the front for me. Thank you. Okay, so same with the anterior chest. I'm looking for any skin abnormalities, any lesions. We'll feel real quick for any lumps. or masses, which I do not feel. And the chest does appear symmetrical. The patient's respirations are even and unlabored. And so now we'll auscultate the anterior lung sounds. We're going to start at the apex of the chest. Take a deep breath in and out. Very good. Good. So the patient's lung sounds are clear to auscultation, and we compared both sides, and they sound the same, nice and clear. Now I'm going to assess the upper extremities of the patient. Can you extend your hands? Thank you. So I'm looking at the nails and the skin. There are no abnormalities, no lesions. The nail is nice and rounded. It's pink. Cap refill is less than 3 seconds bilaterally. The skin is warm. Skin turgor is nice and plump, normal. Patient's well hydrated. I'm going to palpate the wrist. And I hear no crepitus, no popping. Okay, let's turn your arms inward. I'm going to palpate the radial pulse. It's equal and +2 bilaterally. Brachial pulse, also equal and bounding. Feeling for the epitrochlear lymph nodes, and they are normal, no enlargements. Now we're going to assess the range of motion in your shoulder. So if you can repeat these movements. So up, very good. And let's hyperextend. Hyperextend, very good. And internally rotate. And then put your arms at your side. Abduction, adduction, come down, there you go. And then let's do external rotation. Very good, very good. Range of motion in the shoulder is normal. Now we're going to assess the range of motion in your arms. So flex your arms for me, up, and extend them down. Very good. And then we're going to put your arms out like this, supination and pronation. Very good. Let's test the muscle strength in your arms. So flex your arms for me. I'm going to press against them and you push back. Very good. Now I'm going to put resistance on the backside and pull towards you. Very good. So muscle strength is 5 out of 5 bilaterally in both arms. Now we're going to assess the range of motion of your hands and your wrists. So if you can hold your wrist out like this, move them up and down. Very good. Rotate. Good. Spread your fingers out. Bend your fingers best you can. Very good. And make a fist. Touch your thumb to your pinky in both hands. Very good. Okay. Range of motion is intact for the hands and the wrist. And we're going to assess the muscle strength in your hands and wrists. So if you can put them out again, you're going to press down and good resistance there. Very good. Okay. And then grab onto my hands for the muscle strength. That's good. So the patient's muscle strength is 5 out of 5 bilaterally for both hands and wrists. Now with the patient laying at a 30 to 45 degree angle, I'm going to assess the patient's jugular venous pulse. And so, Mr. Martin, can you please look to the left for me? And the venous pulse is visualized on the right side. And can you look to the right? Jugular venous pulse is visualized on the left side, which is normal. Now I'm going to continue with the assessment of the heart. So first we're going to begin by inspecting the precordium And I'm looking for any abnormalities and any pulsations, which I do not see any. And I'm going to also palpate the chest and feeling for any thrills, and none are noted. Feeling the apical pulse, which I do feel, which is normal. And now we're going to actually auscultate the apical pulse and rhythm. Normally, I would listen, auscultate for a full minute at the apex, which is located fifth intercostal space, midclavicular line. But I already assessed the patient and his pulse was normal at 72 beats per minute. And he is in normal sinus rhythm. I heard S1, S2. Now we're going to auscultate the heart sounds with the stethoscope, first with the diaphragm, then with the bell. So first the aortic, then the pulmonic, Erb's point, the tricuspid, and the mitral. And S1 and S2 were heard. Now switching to the bell of my stethoscope. Again, aortic, pulmonic, Erb's point, tricuspid, and the mitral. And no murmurs were heard upon auscultation. And I'm going to have you, Mr. Martin, before we conclude the cardiac assessment, can you lean slightly left? Thank you. And I'm going to listen at the apex with the bell of my stethoscope. Very good. Thank you. Okay. Now moving on to the abdominal assessment. Again, with inspection, I'm just looking at the abdomen and I'm looking for any, again, the shirt would be removed. Normally, I'd be looking for any skin abnormalities, any lesions. I'm looking to make sure that the abdomen is symmetrical with the rest of the patient's body, which it is. And now we're going to auscultate in all four quadrants. And I don't see any pulsations either. So, okay. We're going to go with the right lower quadrant first. Right upper quadrant. Left upper quadrant. Left lower quadrant. Good. And I'm also going to listen at the aorta with the bell of my stethoscope for any bruits, and none are noted. Now I'm going to percuss in each of the four quadrants. Any pain or tenderness? Okay, very good. No pain or tenderness noted upon percussion. And as far as palpation, any pain or tenderness?
No.
Okay, very good. That concludes the gastrointestinal abdominal assessment. Now we're going to assess the hips and lower extremities. Beginning with the hips, we're going to test the range of motion. Can you lift your leg up and move it out and bring it back in? Very good. And same, up, out, and in. So that's flexion, abduction, adduction. Wonderful. And I'm going to put pressure down, lift your leg. Good. Move your leg out. Good. Same. Oh, sorry. Okay, try to, there you go. Muscle strength is 5 out of 5. And now I'm going to move to lower extremities. I'm looking at the skin It's free of lesions. There's no abnormalities. The lower extremities are symmetrical. And I'm going to palpate the popliteal pulse, the dorsalis pedis pulse, and the posterior tibialis, and they're all normal and bounding, equal on both sides. And the skin is nice and warm. There is no edema on the lower legs or the feet. And now I'm going to test the range of motion again for the feet. So can you lift your feet up for me and press them down? Invert the feet inward and outward. Very good. And then with resistance, lift up and push down. Very good. So the range of motion in the feet are intact. And we are going to look at the toes, inspect each one, checking the cap refill, which is equal. Okay. Take the heel of your foot and run it down your shin. Okay, very good. That's testing the cerebellar function. And now we're going to test the Babinski reflex. Which is intact. Now I'm going to assess the musculoskeletal and neurological system. Can you please bend your knee forward and back? Forward and back. Against resistance. Good. Now I'm going to test the patella deep tendon reflex. And it is normal. Please close your eyes for me. Can you tell me if this is light or heavy sensation?
Light.
Okay, and where am I touching?
My face.
Where am I touching?
My arms.
Now?
Hands. Knees. Lower leg.
Very good. That test is normal. And at this point, we would normally perform the pain discrimination exam using sharp or dull objects. However, prior to this exam, that test was performed and the patient was found to be normal. And now we're going to test for stereognosis. Can you please lift your palm of your hands out for me? Close your eyes. What number am I writing?
6.
And now?
8.
Very good. Now we're going to test the middle finger position. Okay, again with eyes closed, can you tell me if I'm going up or down with your middle finger?
Up.
Up or down?
Down.
Up or down?
Down.
Up or down?
Up.
Very good. That is normal and intact. And then now, can you repeat these movements? Just like this. Okay, so rapid alternating hand movements are normal. Testing the cerebellar function, which is intact. And now if you can please rise, Mr. Martin. Please walk across the room. And when you come back to me, please walk heel to toe. And walk again back on your toes though. And then when you come back to me, please walk on your heels. Very good. Now we're going to test the Romberg sign. So I'm standing by my patient for safety. Make sure your feet are together, legs together. And I'm noting any unsteadiness. The patient does not appear that he's going to fall. And when you perform this, you're going to ideally want to wait 20 seconds. And that's with eyes open. Please close your eyes. And again, 20 seconds, we would watch to see if the patient is unsteady or is about to fall. And you can open your eyes. He performed that normally. Okay, now please bend forward, side to side, twist side to side. Okay, and I'm going to stand by you for support. Please lift your knee. Very good. Okay, so that concludes the head to toe assessment. Thank you so much, Mr. Martin, for participating.
Thank you.